Shadow Minister for Health. I'm joined today by my colleagues Burton Bailey, Helena Konanz, and Dr. Matt Strauss. They've done incredible work on the Health Committee in exposing what we are here to discuss today, so thank you to them. I also want to thank Bloc Québécois MP Maxime Blanchet-Jonques for his work in helping expose this at Health Committee. Unfortunately, he couldn't be here this morning. Today, Conservatives are calling on the Auditor General to launch a full investigation into the Liberal scandal that has cost Canadian taxpayers over $300 million. Conservatives are calling on the Auditor General to investigate PrescribeIT. Most Canadians have never heard of PrescribeIT, and that's exactly how the Liberals wanted it. So let me tell Canadians about PrescribeIT. In 2016, the Liberals announced a software program that was supposed to modernize how prescriptions are sent in Canada. They promised PrescribeIT would eliminate fax machines for prescription drugs. They announced a $40 million budget. 10 years later, the cost for PrescribeIT has exploded to over $300 million. So what do Canadians get for their $300 million? Well, that's the $300 million question. Because as of today, doctors are still faxing prescriptions, and less than 5% of all prescriptions go through PrescribeIT. Let me repeat that. After nearly a decade and more than $300 million, less than 5% of the prescriptions go through this program. Earlier this year, the Liberals quietly cancelled the program, hoping Canadians wouldn't notice their money was gone. When I asked the Health Minister in question period where the $300 million went, her answer was, and I quote, "The money has been spent." She's right. The money has been spent. But if Liberal success is measured by how much money they can spend, then every scandal is a success story. Canadians deserve accountability. So let me explain what Conservatives uncovered and what the Liberals refused to tell us. On April 21st, at Health Committee, we began to add things up. TELUS Health testified they received $98 million to develop PrescribeIT from Canada Health Infoway. Canada Health Infoway testified they spent $250 million to design and build PrescribeIT from Health Canada. And the Health Minister's officials testified the Liberals spent $298 million on PrescribeIT, which leaves millions of dollars unaccounted for. My colleague, Dr. Strauss, uncovered something else from the Health Minister's officials. The Liberals are giving Canada Health Infoway another $50 million to pivot away from PrescribeIT. You think about that. The same organization that oversaw this $300 million failure is now being handed another $50 million to move on from it. That means the total cost of PrescribeIT is closer to $350 million. So where'd the money go? The CEO of Canada Health Infoway, Michael Green, was asked at Health Committee to explain how taxpayer dollars were spent. He could not name who was paid or where the money went. And yet, despite years of failures and missed targets, the Liberals kept paying him more money for PrescribeIT. When my colleague, Ms. Konanz, directly asked Mr. Green what his salary was, the salary Canadian taxpayers pay him, he refused to answer. See, let that sink in. A man who runs a federally funded organization that just burned through $300 million of public money on PrescribeIT refused to disclose how much the Liberals paid him for his failure. In the private sector, if any CEO who oversaw a $300 million loss would be fired. But Mr. Green thinks he is immune because it's not his money, it's your money. And he knows the Liberals will shield him from accountability. Conservatives will not tolerate the secrecy and contempt towards Parliament. That's why we summoned Health Canada Infoway CEO Michael Green back to committee next week. Now, let me turn to our concerns on the intellectual property of PrescribeIT. My colleague, Mr. Bailey, asked TELUS Health how much of the $98 million they received for PrescribeIT went towards creating intellectual property. The representative stated, and I quote, "I cannot disclose those details." When Mr. Bailey asked how many PrescribeIT jobs were outsourced, they stated, and I quote, "I don't have those details in terms of outsourcing jobs." And when I asked whether TELUS Health would use the technology developed from PrescribeIT to monetize a future e-prescribing service after the program ended, they said it was an option. It appears that Liberals spent tax dollars building software for a private company and failed to ensure it would belong to Canadians. But the most damning admission at the Health Committee came from the Health Minister's officials. Officials admitted that the Liberal government did not conduct a formal program evaluation before handing Canada Health Infoway $211 million for PrescribeIT in 2023. According to their testimony, the Liberals knew that PrescribeIT was failing and would never be self-sustaining, but they signed a $211 million check anyway. The Liberals are also promised in their 2017 budget that PrescribeIT would reduce opioid fraud and misuse. Conservatives asked the Health Minister officials how much opioid harm PrescribeIT reduced. Their answer was, and I quote, "I don't think we have that data." 10 years and $300 million later, and the government cannot say whether PrescribeIT did anything they promised. That is why Conservatives moved a motion to release the PrescribeIT documents. We asked for contribution agreements, the intellectual property records, the vendor payments, and the performance reports. In other words, we asked for the documents that would show Canadians where their money went. And what did the Liberals do? They filibustered to block a vote. And now, with Mark Carney's backroom majority, Parliament may never see the documents. This is exactly why the Auditor General must investigate PrescribeIT. If the Liberals have nothing to hide, release the documents. If Canada Health Infoway did nothing wrong, release the documents. Tomorrow at noon, the Health Committee will hold an emergency meeting on PrescribeIT. Conservatives will move a motion to call in the Auditor General. We are urging the Liberals to support our motion and end the cover-up. Canadians did not benefit from PrescribeIT, so the $300 million question is simple. Who got rich? It's time to call in the auditors. Thank you. And with that, I'll call upon Dr. Strauss to bring some remarks.
Thank you, Dan. Thank you, everyone, for being here. My name is Matt Strauss. I'm the Member of Parliament for Kitchener South Hespeler, and I have practiced medicine throughout Ontario over the last 13 years in London, Kitchener, Guelph, and Kingston. At no time over those 13 years did I ever have even the option to send a prescription with PrescribeIT. So they blew $300 million on a program that didn't even roll out to any place that I ever worked. No wonder more than 95% of prescriptions are not made through this platform as of today. Even so, the segment of physicians who do use this platform, like Dr. Boltson in St. Thomas, Ontario, feel that the rug is being pulled out from under them. The program is being shut down abruptly on May 29th. The Liberal government gave Canada Health Infoway $300 million. That money is gone. And they plan to give another $50 million to that same organization to pivot to some other solution. But no one from either the Ministry of Health or Canada Health Infoway has any idea whether physicians like Dr. Boltson will have any sort of a solution in place on May 29th. This is crazy. Possibly it is merely incompetence and sloppy spending. But when you look at the scale of this, $300 million with zero tangible benefit, Canadians have a right to start wondering if there was fraud or corruption involved. The whole thing smells rather like the Ontario e-health scandal from 2009. That is why we have asked the Auditor General to investigate. $300 million could have built multiple community hospitals, brand new community hospitals. There needs to be justice, and there needs to be a plan in place to never blow that kind of money again. Healthcare in this country lacks resources, patients are suffering, and Liberal consultants made off with $300 million that could have gone to help them. Thank you.
And with that, we'll take some questions.
I guess just off the top, I'm curious, like how, can you kind of walk me through how you guys came onto this in the first place?
Well, it was the Globe and Mail article that started up at the very first, and thanks to that, we started an investigation into that, and once you started pulling the thread, it was just actually quite devastating. You know, and the 5% uptake, I mean, that should flag anybody that was, that amount of money being spent was absolutely ridiculous, that no one was using the program and $300 million was gone.
I guess just, and whoever wants to answer this, but with regards to kind of how the program was supposed to function, was there some use for it with regards to trying to modernize how prescriptions are sent? I don't know if the doctor wants to take that up.
You want to say anything?
Sure. So I think I said in the House, I think the goal was laudable, and actually it came with a motto. The motto was axe the facts, which is a rhyming three-word verb the noun motto, which turned out to be an empty slogan. So the Department of Health officials now say, well, Canada's a vast country. It actually turns out this was totally impossible. There's regional differences and territories, and but yeah, the goal behind it, like nobody wants to still be using fax machines, but to blow $300 million over 10 years and to have made zero progress in axing the fax actually is a big problem.
Mr. Mazier, I have a question for you. So with the potential imminent change of the committee structure by the Liberal government, given the majority reflecting in the House of Commons now, what's your realistic expectations on getting these initiatives moved forward?
Well, we hope the Liberals will see their wills, their ill ways. I mean, before, even with the minority parliament, they were trying to block it before. So that tells me that something's really up. And Canadians, the bottom line is Canadians didn't vote for that. And for the Liberals to jury-rig the committees is I think it's a slap in the face to every Canadian that voted for a Liberal in the last election.
Last Friday, Health Minister Marjorie Michel made an announcement in Montreal. She pledged $8.6 million for initiatives regarding the Black community. Under her portfolio as minister, she's also dealing with initiatives for mental health. She believes, and her government believes, that systemic racism or anti-Black racism is prevalent in health care and mental health services in the country. Do you share that view, and would you be supportive of the initiatives, or do you have any commentary to share on that? Pierre Poilievre, of course, spoke with me on Friday and mentioned that he doesn't support these race-based or gender-based or ethnic group-based initiatives and announcements.
Well, and I think today, I mean, if the history of the Liberal spending is an example of this program and how it runs, like anything that the health minister is announcing today and in the future, I have to be very skeptical of. $300 million was spent over 10 years, and not one report was made out that was in line of what taxpayers were expected for. Like a simple thing like axing the facts. Like 10 years, and then they turn around and give them more money and say, oh, well, nothing to see here. So I think there's a bigger problem in the end of the day with that.
Can I ask Mr. Mazier, in your view, who needs to resign over this?
Well, right now, we just want the facts. I mean, who was accountable? I think, and you know, the bigger question is, what did the Liberals actually have in those agreements that Canada Health Infoway signed away to TELUS Health, right? Like, if they actually said, oh, no problem, take the intellectual property of Canadians, well, that's a bigger problem. And that lies at the feet of the Liberals. And I think that's where the focus needs to be. And that's probably why we're seeing this cover-up.
Just for a second, the Prime Minister's announcement today on the Sovereign Wealth Fund, can I just get your reaction to that and what Conservatives think of that announcement?
And if we go back to anything these Liberals touch with when it comes to money and trying to manage it, if it's run like this program, we're going to be in trouble.
Dan, do you mind if I?
Oh, yes, go ahead.
Yes, I just want to mention that we're trying to get to the bottom of this $300 million boondoggle. Last week, the CEO of Infoway, Michael Green, adamantly said multiple times that it was his board that made the decision to end the program. And then on Friday, during question period, the Parliamentary Secretary for Health said in question period that it was her government, the government, that decided to end the program. So we're just trying to get to the bottom of this, and that's why we've asked for the documents, that's why we've asked for this emergency meetings, and that's why we're here in front of you. So we need to find out the truth. Whose fault is this, and what are we going to do about it?
Question for Matt. You're young, you're also a doctor.
Thank you for saying. I'm 40, but
well, coming from the generation of open-minded on reforms, new technologies, new programs, you even said that this was a laudable goal. So What were some of the challenges you would have hoped that the government would have been able to overcome, or what kind of platform would Conservatives have raised to succeed in this goal of bringing, axing the, guys talking about axing the tax, perhaps axing the facts? How would you have accomplished that, or how would you have hoped the Liberals would have managed to do things better?
Yeah, I'll preface this by saying the fact that there was a laudable goal behind this, that doesn't make it better. That makes it worse. Like, they wasted $300 million and 10 years on axing the facts, and the facts needs to be axed. So the fact that they've done no helpful work on an important portfolio, that's even worse. As to the question for why it failed, just from the testimony that we had at committee, it sounds like they have now identified that the majority of physicians find the software solution cumbersome to use. They're very, very busy. They don't like to do paperwork. They're already logged into multiple electronic health management systems, and adding another one on top of that was just a non-starter for most of them. So that's why we see so few prescriptions actually going through the program. This is in terms of what they told us at Health Committee. So if you build a solution, but the people to prescribe, but the people who actually do the prescribing hate it and don't want to use it, like you haven't moved the ball down the field at all. And so, and then to the last part of your question, how could this have been better? Well, I imagine that bringing these prescribers, the physicians who didn't want to use it, in on the ground floor and be like, what do you need in terms of a user interface? How can we make this a solution that you'll actually want to use? Would have been key.
Some pharmacies also were kind of reluctant because of the 20-cent fee per prescription on there. Can you speak about that at all? Is that something that came up in committee?
That came out in testimony as well. They turn around and they penalize them when they run out of money. You decide to charge them a 20-cent fee, and that, of course, that was the death nail into it. But and just to follow up a little bit on this, there is no reason why this program cannot be handled by the private sector. Like, why are the Liberals in the middle of a transactional deal between a doctor and a pharmacist? Like, it should just happen naturally, and develop the app. There's lots of different management systems out there around the world. I'm sure they could have gone over and spent a millionth on what actually could have been spent on this program.
Thank you.
That's it. Thank you.